If you're using peptides and haven't addressed your sleep, insulin, or stress first, you're probably skipping a step. And that might sound really surprising given the current state of how popular peptide therapy is right now. And as a functional medicine physician, I get asked about peptides almost daily. And, peptides can be really helpful, but they don't replace the foundation of your health. And I think that's a common misconception. When they're used at the wrong time, it can lead to disappointment, failed results, bad outcomes. So today, let's talk through why I don't always start with peptides and how to think about when they actually make sense for a patient. The short answer is this: peptides aren't unsafe. They're just often used at the wrong time in the wrong context and without enough clinical oversight. You see, a common thing that people don't realize is that functional medicine isn't just about adding more things. People think functional medicine equals more labs, more supplements, more protocols, peptides for everyone. But good functional medicine isn't about doing more. It's not about volume. It's about understanding what the body's asking for and choosing the right tool to match that at the right time. At their core, peptides are signaling molecules. They're short chains of amino acids that help cells communicate better with one another. The body already relies on peptides in abundance every single day for everything from healing and metabolism and immune system signaling to hormonal communication and brain functioning. So the real question is almost never, do peptides work? The better, more appropriate question is, do peptides make sense right now for this given individual? Because peptides don't replace lifestyle, nutrition. They amplify signals. They turn up the volume. And if the underlying message or the environment in the body isn't supported and ready, that amplification can lead to noise instead of progress. Before I consider peptides, I usually evaluate extensively, and that includes things like sleep quality and restoration of sleep, stress and nervous system regulation. I look at blood sugar, insulin, and metabolic dysfunction, as well as inflammatory markers and overall hormonal balance. Because when those systems aren't aligned, peptides oftentimes don't fix the issue. They simply reveal where the imbalance already exists. And this makes people really get discouraged because they expect by adding something new, they will get this meaningful, wonderful improvement that they've seen online, but instead they feel nothing, or they feel worse. Now, that doesn't mean that peptides are necessarily harmful, right? It usually means the system wasn't ready or it wasn't deployed correctly. And it's not just about timing. You see, one of the biggest risks I see with peptides relates to quality and dosing. And many people don't realize that peptides are widely accessible, or maybe people do realize it because they're buying them online and there's very little transparency around purity or consistency. You see, when quality control is lacking, that's when problems can arise. And I've unfortunately seen situations where people react not to the peptide itself, but they're actually reacting to contaminants or impurities in the peptide or inconsistent concentrations. Things like endotoxins can contribute to inflammation, immune response, or people feeling significantly worse. And most complications people associate with peptides actually come from quality issues, dosing mistakes, or inappropriate timing, not the peptide itself. When I consider peptides for a patient, I'm very deliberate about sourcing. I think this is really important. It means working with suppliers that provide third-party testing, purity verification, and there needs to be consistency between batches. The other major factor is dosing. This isn't something you can easily look up. Peptides are signaling molecules, and too much, too quickly, or layered incorrectly can overwhelm the system. It really requires education and proper dose adjustments. Dosing isn't guesswork. It really needs to be individualized, monitored, and adjusted carefully. And that's a major part of how risk is reduced when it comes to peptide treatments. In functional medicine, timing matters just as much as the intervention that I'm using. And sometimes the most important step is saying, no, peptides aren't right now. We need to stabilize your system first before we introduce anything that encourages growth or increased signaling. That approach, it really allows for the body to respond more predictably and to just overall be more safe. There are situations where peptides should be the first step, and they can be really supportive. And typically that's when patients come to me with the foundation already laid. They're working on lifestyle, nutrition. There's a very clear physiologic goal we're trying to achieve, and the decisions around dosing, duration, cycling, monitoring, they're made intentionally, and we make them together. In those cases, peptides function best as a gentle nudge, right? Not a shortcut. They don't replace the lifestyle changes we talk about. There's something else that I think really matters. I think it's a disservice to patients when physicians aren't educated about the therapies people are already curious about and seeking out on their own. Because when physicians aren't part of the conversation, that doesn't mean that people stop looking for that intervention. They simply look elsewhere. And it's often online, often without guidance, often without context. And that's when it's not very safe. Much of what's available online looks really nice. It's polished, professional packaging, clean branding, but that doesn't necessarily mean it's high quality or well understood or being used appropriately. And from my perspective, part of my responsibility as a physician is to stay educated and understand the science and help people navigate emerging areas of health and use these things safely and thoughtfully. Peptides are a fascinating area of medicine, but like anything powerful, they require judgment, context, and a whole person consideration. You see, my goal isn't to push more therapies, more treatments. It's to help people make informed decisions with clarity instead of confusion and discernment instead of the hype. When peptides are used thoughtfully with good sourcing, appropriate dosing, and the right foundation, they can be an amazing tool. But when they're rushed or treated as a DIY project at home, that's when problems arise. Any intervention that affects growth, repair, or signaling deserves our respect. You see, good medicine isn't just about what we can do. It's about what we should do for an individual person at a given time. We need to understand the context of their health before we add these powerful substances. So if you've ever been curious about peptides or felt disappointed if your physician didn't jump straight to them, that hesitation isn't always a flaw. It can be discernment. And thoughtful medicine always starts there. If this approach resonates with you, I'm Dr. Kelly Brown. I work with patients through my practice, Ember, where care is individualized and thoughtful. And you can request a discovery visit through the link below and explore whether or not this kind of care is a good fit for you. Have a great day.